Welcome. I am Dr. Thomas Gerber, one of the Associate Editors of Mayo Clinic Proceedings. In this recording, I would like to review for you the articles that our Editor-in-Chief, Dr. William Lanier, has chosen to be featured on the cover of the October 2012 print journal, along with the accompanying editorials. The original article, entitled Ideal Cardiovascular Health and Mortality, Aerobic Center Longitudinal Study, was authored by Dr. Enrique Artero from the University of South Carolina in Columbia, South Carolina, and colleagues from several other national and international institutions. The authors estimated the prevalence of ideal cardiovascular health in almost 12,000 individuals recruited into a longitudinal study between 1987 and 1999. Cardiovascular health was assessed based on the Simple 7 construct from the American Heart Association. The authors found that only 0.2% met all 7 ideal metrics. Cardiovascular death was 63% lower in those who met 5 to 7 ideal metrics and 55% lower in those who met 3 or 4 ideal metrics than in those who only met 1 or 2 ideal metrics. The accompanying editorial, The Pursuit of Ideal Cardiovascular Health, an Individual and Societal Challenge, was authored by Dr. Francisco Lopez Jimenez from Mayo Clinic in Rochester. He discusses the advantages and shortcomings of the Simple 7 definition of cardiovascular health. He also points out that increasing awareness of cardiovascular risk without implementing or providing proven strategies of intervention has failed to improve health behaviors. He emphasizes that increased awareness and willingness to improve personal health should coincide with changes in public policy, population-based interventions, and implementation of universal health care if major improvements in the cardiovascular health of the general population are to be accomplished. The commentary, entitled The High Cost of Cancer Drugs and What We Can Do About It, was authored by Drs. Mustaqim Siddiqui and Vincent Rajkumar from Mayo Clinic in Rochester, Minnesota. Going from 2 questions: first, why are cancer drugs so expensive? And second, what policies or interventions can be employed to lower the cost of cancer drugs? The authors provide an overview of the major factors affecting the cost of cancer drugs, with the intent of stirring debate and discussion. The special article, entitled 10 Common Questions and Their Answers About Off-Label Drug Use, was authored by Dr. Christopher Wittig and colleagues from Mayo Clinic in Rochester. In their article, the authors introduce and answer 10 questions regarding off-label drug use in an effort to clarify the meaning, breadth of application, acceptance, and liabilities of off-label drug use. This is important because many healthcare professionals do not have a full appreciation of the definition, prevalence, and implications of off-label drug use, but a good understanding is important to allow weighing the risks and benefits of prescribing medications for off-label use in a way that ensures the best possible care for patients. Dr. Craig Bunnell from the Dana-Farber Cancer Institute in Boston, Massachusetts, authored an editorial entitled Integrating Value Assessment into Discussions about the Price of Cancer Drugs. This editorial also addresses issues raised in the previously mentioned article about off-label drug use. Going from the adage that price is what you pay, value is what you get, the editorial provides a separate perspective on the mechanisms determining the use and cost of drugs. In particular, in Dr. Bunnell's view, the future will bring advances in the science and understanding of cancer, and with it new high-cost anti-cancer drugs. The value of these drugs, however, should be determined rationally, and such value judgments should be integrated into guidelines for clinical care. The original article, entitled Asthma and Pro-Inflammatory Conditions, a population-based retrospective matched cohort study, was authored by Dr. Hyun Yan from Mayo Clinic in Rochester and colleagues from several other healthcare institutions. In almost 2,400 asthmatic individuals and 4,800 non-asthmatic controls among residents of Rochester, Minnesota, the authors found that the presence of asthma may increase the risk of coronary artery disease and diabetes, even though these diseases have different immunologic mechanisms. As an important implication of this finding, physicians who care for asthmatic patients should address the risks for diabetes and coronary artery disease carefully. The review article entitled Melanoma in Immunosuppressed Patients was authored by Agnieszka Kubika and Dr. Jerry Brewer from Mayo Clinic in Rochester, Minnesota. In an effort to reconcile the results of multiple studies of the immunogenicity of melanoma, the authors summarize data in the literature on the role of immunosuppression in melanoma and discuss several immunocompromised patient populations in detail. Based on their information synthesis, they propose recommendations for the care and monitoring of immunosuppressed patients with melanoma. The review article entitled Human Herpes Viruses 6, 7, and 8 from a Dermatology Perspective was authored by Dr. Michael Walls and colleagues from Mayo Clinic in Rochester. The authors note that studies of etiologic associations between human herpes viruses and skin disease are complicated by the ubiquity and nearly universal prevalence of some herpes viruses. To provide a practical review for physicians likely to encounter skin disease associated with herpes viruses such as Roseola infantum, lichen planus, pityriasis rosea, and Kaposi sarcoma, the authors summarize the findings of a comprehensive literature search between 1998 and 2011. This month's concise review for clinicians is entitled Clinical Pearls in Breast Disease and was authored by Dr. Sandhya Pruthi and colleagues from Mayo Clinic in Rochester, Minnesota. Derived from a teaching format to aid physician learning that was originally presented at an annual conference of the American College of Physicians, the authors present 6 short cases of patients with breast problems that each are followed by a multiple-choice question and in-depth discussion that ends with a concise clinical pearl. Issues addressed in the current review include lymphedema, nipple discharge, and risk assessment in women with a family history of breast cancer. Authors or co-authors of 6 of the articles we have discussed have provided video interviews. These interviews are available on the homepage of Mayo Clinic Proceedings at www.mayoclinicproceedings.org in the upper right-hand corner. There, you will also find 3 additional video interviews on articles related to our October issue. Also on the website, our series entitled Meet the Mayo Clinic Proceedings Editorial Board and Staff this month features Dr. Thomas Beckman from Mayo Clinic in Rochester, Minnesota, who is among several who have been on the editorial board for many years and was recently named Associate Editor. As you know, you will also find on our homepage additional content that is not available in the print journal, such as extra residence clinics articles, medical images, stamp vignettes, and other materials. Dr. William Lanier, Editor-in-Chief of Mayo Clinic Proceedings, the entire editorial board, and I sincerely hope that you will enjoy these and the other outstanding articles in the October 2012 issue of our journal. We do thank you for your interest in and continued loyalty to Mayo Clinic Proceedings, and we are grateful for your ongoing support of our journal's mission to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. As a preview, the November issue of Mayo Clinic Proceedings will contain articles on end-of-life care decisions, Importance of reviewing systems and limitations following 2 recent North American cases, considerations on safety concerns with citalopram prescribing, and 2 articles and 1 editorial related to Clostridium difficile infections. Our November issue will go live on our website on November 6, 2012. Thank you.
We hope you benefited from this presentation based on the content of Mayo Clinic Proceedings. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you're interested in more information about Mayo Clinic Proceedings, visit our website at www.mayoclinicproceedings.org. There you will find additional videos on our YouTube channel, and you can follow us on Twitter. For more information on healthcare at Mayo Clinic, please visit www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.